Hiya. So today I'm going to talk about what the negatives of the scoliosis spinal fusion surgery are. Um, Again, mostly talking from my own experience, but have heard stories, obviously, many from other people. Um, so first off, what you might have heard is that sometimes it can get infected or it can fail quite soon after the surgery. Personally, that didn't happen to me, and I did really well. I healed really well, and I was in no pain for 6 years after my surgery. I did really well. I was able to have a professional dance career. It's important after the fusion surgery for your nervous system and your soft tissues to adapt to make sure you rest and do what the doctor says. Take your antibiotics, take your painkillers, whatever you need, and eat well and rest and rest. So perhaps, I don't know, like obviously everyone's different. It might not be anything they've done as to why it gets infected or fails. But yeah, my best advice to stop that one happening, straight after, is to make sure you do everything the doctor says and rest well, so that everything adapts well and you're used to it, and then you move forward. Like for me, I had 6 months before I was allowed to exercise again. And yeah, everything went really well to start with, so that's one negative that can happen. But I think that's very rare. And then the main thing for me was later down the line, stiffness and chronic pain, basically. So the main thing is that everything just got stiffer and stiffer throughout the years, starting, in my mid-20s. And I probably overdid it overall because I wasn't given any advice. So I probably didn't rest enough and did too much exercise, and maybe didn't take enough supplements to detox and clear stuff out. So I'm going to do another video on things to do to help look after your fusion surgery, that I've learned in hindsight. But yeah, I mean, it's unavoidable eventually that I have arthritis where the fusion is in my thoracic spine, because I've got discs missing, and I lack mobility in the spine. It needs that mobility to stay moist and to to avoid, to clear stuff out and to avoid developing any kind of arthritis. So that was kind of inevitable that I'm going to get some wear and tear, and it's going to become stiffer and stiffer because of the lack of movement. But another thing that I wasn't aware of, that in hindsight I would change, is that you can get problems with your discs just above and below because of too much movement in those places. So, I mean, because I did a professional dance career and I exercise lots, I went running and I do things that I probably shouldn't have done, that would cause too much movement, and rotation, like stretching below particularly, is very painful, and above, inevitably looking back, again, I'll talk about in my next video, I would do things differently, just do different exercises that suit the fusion, rather than trying everything out to try and get proprioception and help myself, because that's obviously, probably most people know who've had it. Another negative is that you become very numb, like proprioceptively, you have a scar tissue around it and it's numb, and there's less nerve supply and blood supply, so it's hard for you to be aware of the fusion. But slowly, carefully over time, with somatic, very gentle massage and somatic type approaches, you can gain proprioception around the fusion, and you can gain more awareness of your muscles, and that get power and control around there. So again, that I'll talk about that in my next video. But yeah, and then another thing is, because it gets stiffer, and there's less movement, I developed chronic fatigue syndrome as well, because my body was just less hydrated, you know, without, because I couldn't get enough blood and hydration, and everything dried out and got stiff. Yeah, I just got more tired and attracting more, the metal rods, they can attract bacteria, which is why, I mean, you might have seen in some other videos I had a bad tooth infection, and that spreads stuck to the metal, like sort of sucked down. So yeah, another negative is that the metalwork can attract more bad bacteria, and it can release toxins. Mine are titanium, so I have to detox heavy metals and bacteria. I take the chlorella powders, you know, regularly, every week really. I'm detoxing myself, and trying to get like more, you know, movement and hydration, so it's less stiff in those tissues. So I'm very gradually doing that. And you have to be very careful and gentle and slow, because another negative is you can trigger PTSD. Obviously, because the surgery is so traumatic, you don't really, you know, to try and get feeling and awareness back in that area can be very traumatic, and it can trigger PTSD. So I've had to go on pregabalin tablets to numb and block the nerves, so I can't feel that. So yeah, so far. Oh, and obviously sometimes some people, they can, with it failing, they can break a rod. So don't do any back bends, don't do anything like physical contact sports. Yeah, just rest enough and look after it, and try and gain as much awareness you can. And yeah, I'm 36, so that's the only negatives I've had so far. Sometimes it feels like the rod is like impinging and trapping nerves, and I can have a little shake and then that passes. So definitely people can get some nervous problems, and the stiffness of the rods as well can affect flow throughout the organs and the digestive. Like sometimes I feel a bit more blocked digestively. But yeah, I mean, everyone's story is completely different. So yeah, those are my negatives. Thanks for listening.